Etiology of the disease. The underlying cause of pericarditis may be infectious or non-infectious. Viral infection is the most common cause of acute pericarditis and accounts for 1 to 10% of cases. In developed nations, although pericarditis is predominantly referred to as idiopathic, the most frequent causes are autoreactive, lymphocytic, malignant, and infectious. Infectious pericarditis is most often viral or idiopathic. Purulent bacterial pericarditis is uncommon but may follow infective endocarditis, pneumonia, septicemia, penetrating trauma, or cardiac surgery. Often, the cause cannot be identified, called nonspecific or idiopathic pericarditis, but many of these cases are probably viral. A retrospective study 2004 to 2014 that evaluated the etiology of acute pericarditis in 32 children found that the most common cause was infectious 34%, followed by inflammatory disorder 28%. Staphylococcus aureus was the responsible agent in 4 of 5 cases of purulent pericarditis. All 5 patients also had concurrent infection of the soft tissue, bone, lungs, or other. Other infectious agents included Histoplasma capsulatum, Mycoplasma pneumoniae, influenza A, and enterovirus. Anatomy and physiology of cardiovascular system. The human heart is located within the thoracic cavity, medially between the lungs in the space known as mediastinum. As you can see in the picture, it showed the position of the heart within the thoracic cavity. With the mediastinum, the heart is separated from other mediastinal structure by a thin membrane known as pericardium or pericardial sac and sits in its own space called pericardial cavity. The dorsal surface of the heart lies near the bodies of the vertebrae and its anterior surface sits deep to the sternum and costal cartilage. The great veins, the superior and inferior vena cava, and the great arteries, the aorta and pulmonary trunk, are attached to the superior surface of the heart called base. The base of the heart is located at the level of the third costal cartilage as seen in the picture. The interior tip of the heart, the apex, lie just to the left of the sternum between the junction of the fourth and fifth ribs near their articulation with the costal cartilage. The right side of the heart is deflected anteriorly and the left side is deflected posteriorly. The human heart consists of 4 chambers. The left side and the right side each have 1 atrium and 1 ventricle. Each of the upper chambers, the right atrium and the left atrium, act as a receiving chambers and contrast to push blood into the lower chambers, the right ventricle and the left ventricle. The ventricles serve as the primary pumping chambers of the heart, propelling blood to the lungs or to the rest of the body. Aorta is the main artery that carries blood away from your heart to the rest of your body. Superior vena cava, the large vein that returns blood from the head and arms to the heart. Left and right pulmonary artery. The right pulmonary artery supplies the right lungs while the left pulmonary artery supplies the left lung. Pulmonary trunk is a short artery transporting deoxygenated blood from the heart towards the lungs. Right and left pulmonary veins. It collects oxygen-rich blood from your lungs and carry it into your heart. Right atrium. The right atrium receives oxygen-poor blood from the body and pumps it to the right ventricle. And the right ventricle pumps the oxygen-poor blood to the lungs. The left atrium. The left atrium receives oxygen-rich blood from the lungs and pumps it to the left ventricle. Fossa ovalis represent in the adult the fatal communication between the right and left atrium, allowing for fetal oxygenated blood to bypass the pulmonary circulation and enter the systemic circulation directly. Tricuspid valve. The job of tricuspid valve is to allow blood flowing into the heart from the body to flow to the right ventricle where it's pumped to the lungs for oxygen. Bicuspid valve. The valve allows the blood to flow from the left ventricle pumping chamber to the aorta and prevents blood from flowing backward. Aortic valve. It helps to keep blood flowing in the correct direction through the heart. Pulmonary valve normally acts like a one-way door from your heart's right ventricle to the lungs. Blood flow from the right ventricle through the pulmonary valve to the pulmonary artery and then into the lungs where it picks up oxygen to deliver to your body. Right and left ventricle. The right ventricle pumps the oxygen-poor blood to the lungs while the left ventricle pumps the oxygen-rich blood to the body. Inferior vena cava is ultimately responsible for the transport of almost all venous blood deoxygenated from the abdomen and lower extremities back to the right side of the heart for oxygenation. Pericardial membranes and layers of the heart wall. The pericardial membrane that surrounds the heart consists of 3 layers and the pericardial cavity. The pericardial membrane and the heart wall share the epicardium. The pericardium or pericardial complex serves as a protective barrier from the spread of infection or inflammation from adjacent structures. The pericardium is one of the serosal cavities of the mammals. It consists of 2 anatomical structures closely connected, an external sac of fibrous connective tissue that is called fibrous pericardium and an internal that is called serous pericardium coating the internal surface of the fibrous pericardium. Between these 2 layers, a small amount of fluid exists that is called pericardial fluid. The pericardial fluid is a product of ultrafiltration and is considered to be drained by lymphatic capillary bed mainly. Under normal condition, it provides lubrication during heart beating, while the mesothelial cell that lines the membrane may also have role in absorption of the pericardial fluid along with the pericardial lymphatics. Fibrous pericardium is a flask-shaped, though outer sac with attachment to the diaphragm, sternum, and costal cartilage. Serous pericardium. It is enclosed within the fibrous pericardium. The serous pericardium is itself divided into 2 layers. The outer parietal layer that lines the internal surface of the fibrous pericardium and the internal visceral layer that forms the outer layer of the heart. It is also known as epicardium. Each layer is made up of a single sheet of epithelial cells known as mesothelium. Pericardial cavity, found between the outer and inner serous layers in the pericardial cavity, which contains a small amount of lubricating serous fluid. The serous fluid serves to minimize the friction generated by the heart as it contracts. Endocardium is a thin, smooth tissue that makes up the lining of the chambers and valves of the heart. The innermost layer of the heart walls, it serves as a barrier between cardiac muscles and the bloodstream and contain necessary blood vessel. It also houses the heart conduction system, which regulate the activity of cardiac muscles. Myocardium. Muscle of the heart, termed the myocardium, make up the middle and thickest layer of the heart wall. This layer lies between a single-cell endocardium layer which lines the inner chambers and the outer epicardium which makes up part of the pericardium that surround and protect the hearts.